resident is the final stakeholder, and if they don't have a voice, their family member will.
BC's long-term care residents and their families are getting a bigger say in how their homes should be operated and how people are cared for, as the province strengthens oversight on long-term care.
People have genuinely struggled. I know this because of the many discussions I've had in evenings with family members of long-term care who have expressed sometimes their frustration and sense of loss at a critical time in their loved one's life.
A big part of the province's plan involves encouraging long-term care homes to create resident and family councils if it hasn't been done already, giving them a formal way to communicate with staff. Lisa Dawson has been working to establish more family councils in BC.
It's slow, I'm afraid. Unfortunately, one of the reasons that precipitated this advocacy was because there were some care facilities that just didn't allow the family or resident voice. They just didn't support it.
She says the pandemic made that number even smaller as in-person meetings got cut and the turnover of residents and families slashed the existence of the few family councils.
The COVID experience heightened the importance of long-term care residents and their families having a guaranteed voice. Families felt helpless as decisions were being made that tremendously impacted them and their loved ones in care, yet they had zero input.
I just feel that now the opportunity is there for just a full 360 discussion about their care facility and their care community. It can only improve.
Long-term care homes are not just health facilities, although they are. They're also people's homes. And we need to act that way as we would in people's homes, whether it's in an apartment or a house anywhere in BC.
Dawson says it's significant the health authorities will now oversee the creation of regional resident family councils, which will begin meeting with the independent councils in the spring.
We now have an opportunity, a mechanism, if you will, for the independent family councils to have a voice at their own health authority level.
In Vancouver, Kier Junos, City News.